Hey, what's going on? This is Greg with SportsRehabExpert.com. Today we're going to be talking about how you can use a Voodoo Floss band or a mobility band to help out with knee pain. A lot of people who experience knee pain in the lateral side of the knee, this kind of horseshoe shape around the lateral side of the knee, pain around the fibula as the IT band inserts down, patellar tendinitis, and even sometimes just general patellofemoral type pain. This can help you out and help gradually expose you to more and more loading strategies so that eventually you can get away from using this band in the first place. Now there's three major reasons why you might choose to use this mobility band. Realize that research is probably going to always tell you that this is not very useful. In fact, there's not really much research behind this whatsoever. However, I really don't think there's a problem with using it, especially if you can change somebody's pain and again promote them to gradually expose themselves to more and more loading from a strength and conditioning standpoint to build more capacity. So if this allows an entry point for you to establish more range of motion and more loading at the knee, then I'm all for using this so long as the theme is we're trying to get away from using it obviously as fast as possible so that you don't feel like you're reliant upon it. But the three main reasons why we would choose to utilize this device to aid somebody in their painful issue is, number one, to provide a little bit of a biomechanical assist in the direction that you're trying to move someone towards. We'll talk about that through exercises in just a moment, so stay tuned for that. Number two is it's a way of unloading the tendon through compression, very similar to those patellar tendon straps that you see around the knee. That's a way of unloading tendon because this creates a lot more surface area than what those patellar tendon straps do. Oftentimes this allows you to unload the tendon in those focal points of pain a little bit more significantly. So again, you can gradually expose somebody back to doing more resistance-based exercises. And then third and final reason would be to bring some more blood flow to the area. Obviously you're going to be constricting through a decent amount of compression around your knee here by utilizing this band. What that's going to do is restrict the venous return back towards the heart and create a little bit more of a blood flow kind of cooling and hyperperfusion effect around the capillaries and around the muscle tissue itself, which can have an analgesic effect in addition to the compression, the added security that the band is providing for you. Now, how you wrap the band is key. There's going to be two basic variations for the knee anyways. The first one is going to be around the shin. The second one we're going to talk about above the kneecap. The direction that you wrap it matters more so when we're talking about the shin. So the first concept that we talked about is biomechanics, helping improve biomechanics as a joint mobilization technique. So tibial internal rotation, which is rotating the shin inward, is necessary to achieve a deep squat or a deep knee bend position. So that's what we're going to facilitate with this band, is wrapping it around the calf and pulling the band. If this is 100% tension, pulling it to about 70% tension and wrapping it around the shin a bunch of times till you run out of use of the band, and then you'll tuck it in. Now this gives you, again, that biomechanical assist into knee flexion as we do some knee bending activities, and then we're going to show you how you can also further emphasize that by using a manual technique using your hands. So, easiest way of doing this is put your foot up on a box, and you're just going to rock your knee and try to bend the knee going forward. Now, the box being up high off the ground unloads a significant amount of your body weight, so this should feel a lot more comfortable and you're going through as much range of motion as you possibly can. Actually getting to the point in time where you're thinking about getting the hamstring and calf to touch each other. That's called the wrapping effect in research, and it has a lot of positive influences on improving the joint mobility and the tissue extensibility there. Now, if that's uncomfortable for you, what you can do is use your hands as an assist to rotate that shin inwards, even more so. So we're providing a little bit of guidance by using the heel of my hand and twisting the shin inwards, but my kneecap is still facing straight towards the camera. And we're going to perform this for anywhere from 20 to 100 reps, or just set a timer and do it for 30 seconds at a minimum to upwards of 2 minutes straight. Now, if that feels comfortable, you can start increasing the load a little bit more by shorter box. So this box right here is 12 inches, this one here, 24 inches. So the height of the box adds more resistance because there's more load going down because the box is lower. Still same outcome, we want to try to be able to go through that full range of motion. But because it's a lower box, it's going to be a little bit more uncomfortable to try to sit here and twist the shin inwards. So if we need to provide that bit of assist, it's going to be more useful to do that on the box or actually kneeling on the ground. So in kneeling, you're going to do the same thing. Use the heel of the hand, twist the shin and the calf inward, and rock forward. Repeat that for, again, at a minimum, 30 seconds. Maximum, 2 minutes is probably good. Do that a few times throughout the day if you're really restricted, or once a day at least if you're just trying to gradually improve your mobility. Now, the other one that I like to do to really use gravity to help push into a deep knee bend position. Now notice my toes are going to be pointed in towards each other. That's going to create a little bit more of that tibial internal rotation, which is what happens when you bend the knee into a deep knee bend. So we want the heels away, toes pointing in, and that's how you're going to sit back, butt to heel, trying to, again, get this hamstring calf compression so you get the wrapping effect around the knee to really improve the extensibility of your knee flexibility. Repeat this 20, 30 seconds to 2 minutes in a row. You can hold the position, or you can rock back and forth, whatever's comfortable for you. Some people will get like a pinching sensation here as they try to go deeper into that knee bend position. This often improves it, having the wrap, which allows you to go through a little bit more range of motion. But if you can't get to that depth, just go through the range of motion that you currently feel comfortable with. And this might be all that you currently can do. If you are limited like that, you can also put a towel behind the knee, roll a towel up, and that will create a little bit more of a compression or the ability to contact your hamstring to your calf if you don't quite have the range of motion just yet to sit that far back. So a towel wrapped up or folded up between the knee is a way of helping artificially creating that hamstring to calf touching each other, which again will create that wrapping effect and help improve the extensibility at the knee. So that's another great exercise. And once that gets easy, we can increase the load by simply taking our hands off the ground and sitting up and down onto the back of our heels. Okay, so that was the first option with the band. The second option with the band is wrapping around above the kneecap. Now with this one, it doesn't really matter which way you wrap it, because we're not really trying to improve or influence the biomechanics of the joint underneath of it by wrapping up here. All that we're doing, again, is through the compression in the surface area of the band, is to reduce the tension on the muscles and tendons, as well as, again, providing a blood flow effect by restricting the venous return back up the leg. So again, it's about a 70% wrap, but be smart about it. Obviously, if your foot goes numbness and tingling, take it off immediately. You're not trying to stop your blood flow or occlude your blood flow. You're just trying to restrict it and create some tension and useful compression around the quad. So never work through any numbness and tingling. That should go without saying, but there you have it. Again, it doesn't mean that the other one was better than this one. Sometimes people like this version. Honestly, more people tend to like this version because it has two benefits. It unloads the quad and the patellar tendon, which generally means you have a capacity issue at that tendon, but right now we're just operating under the assumption of being able to load the tendon at your current capabilities and progress you from there, and then also provide that blood flow response. So personally, anecdotally, I find people tend to like this wrap a little bit more, but you can play around with it and try the other wrap and see what you like. But essentially we'll go through the same exercises. There's a few more that you can do with this version here too, but again, we can go through this same range of motion activity. One that I didn't show last time is if you have a box here, you can kind of do like a little bit of a squat onto the leg as well. And that's another way of increasing that range of motion. So those are your really high box options. We got the 12-inch box option here. And then we could go back to the ground. You really wouldn't do this kneeling version with this wrap because again, that's more of the biomechanics, tibial internal rotation. So we'll just go straight to the floor and do the rock backs again here. Same thing, 30 seconds to 2 minutes at each of these positions. You can increase the load by taking away your hands. At any point in time, you get in numbness and tingling, take the band off. But we can do a lot more of our strengthening exercises with this band on too. Something simple as a tap down off a 4 to 8 inch step. Doing a number of different exercises here to build strength, build capacity, do a bunch of reps that build blood flow into the area to help with the healing response and that analgesic effect. So you can do this body weight, you can hold dumbbells in either hand with this, and we're trying to get anywhere from 10 to 50 reps. But it's not necessarily limited to the tap downs. You could also do body weight squats, and whatever range of motion you're currently comfortably able to bend through. Perform same thing, 10 to 50 squats, 3 sets of 10. Don't let your leg go numb. You need to unwrap it if you're feeling some numbness and tingling. And finally, we could be doing some heels elevated squats, where you elevate the heels, allows you to drop deeper into that knee bend range of motion, do a full squat, and do multiple repetitions here. If body weight is uncomfortable for you, you can hold on to something to offload your body weight and just go through the range of motion that you feel comfortable, or use your hands to help pull you up out of that position. But we're never working through pain. Do what you're currently capable of doing. This should provide an assist to allow you to do more. And then when you're all done with that, you can take the band off. Again, do as many of those as you find useful without your leg going numb. Take the band off, and then run through the same exercises again and see what you can do without the band. Because we're always trying to move towards, obviously, doing the exercise and activities without that sort of assist. So you want to repeat those activities without the band immediately after you use the band to take advantage of that blood flow and that analgesic response that you're going to be experiencing with it. Now we'll put links to this band that we use at sportsrehabexpert.com at our recommended products. Now if you're dealing with pain or injury and would like some more specific one-on-one attention, feel free to email me at greg@sportsrehabexpert.com and we can talk about all the options that we have for you directly, where we can work one-on-one to troubleshoot all your problems and get you back to doing the things that you love and enjoy to do. We also have a done-for-you workout. That's called the 0 Weak Links Workout. That you can find at sportsrehabexpert.com. That's a full body workout that addresses multiple areas at once. But if you email me at greg@sportsrehabexpert.com and you sign up for the 0 Weak Links Workout, I can also give you a blueprint for your specific injury. So that whether that's patellar tendinitis, patellar femoral pain, IT band, any type of knee pain in general, I can give you a done-for-you blueprint to help resolve that knee pain as you perform the 0 Weak Links workout. So that's another option that's open to you if you just head on over to sportsrehabexpert.com. And if you're not sure, again, just email me, greg@sportsrehabexpert.com, and more than happy to direct you in the direction that I feel is most best for you, given your current circumstances. So hope you found this video useful. Be sure to like, subscribe to the channel. Share this with anybody who you think may find this video useful. I look forward to bringing new content coming at you very soon. Type in the comments any questions you may have or any videos you'd like to see in the future.